Hi, my name is Ian Bostock. I am a master's student in the Indiana State University Athletic Training program, and today I'll be going over a vacuum splint. You may hear it called a rapid form vacuum immobilizer as well. Today I'll be going over how to use an upper extremity splint. So for this, any kind of splint, you really want to immobilize the area above and below. So as I'll show on Josh, this is what the splint looks like. It will come with a hose. Some may be attached, but this one comes. You attach it. You're going to want to make sure you put the bigger area towards the upper portion of the arm. If Josh has an elbow injury, you want to make sure his arm is in this splint. You want to make sure you can still see the fingertips so you can get capillary refill as well. So what you want to do is find his elbow, make sure the top and bottom portion of his arm are secure. You're going to take this, strap him in. You don't want to cut off circulation. You want to ask them to make sure their arm is okay. They can still feel their arm if there's circulation. Can you feel your arm?
That's good.
Okay. You're going to get a pump that comes in the bag. Most of these will be on the sideline in with the kit. You're going to find whichever end sucks the air out. Attach the hose. You're going to start pumping. As you can see, the splint starts to decrease in size. You'll start seeing a more rigid edge along the splint. Once the pump starts to feel tight, as if you can't pump it anymore, go ahead and stop. You want to leave the splint like this. Josh, could you show as your arm moves? It's pretty stiff. It holds the arm in place until you can get to the hospital. Make sure if you're working with EMS that you tell them to not cut these. These are a little pricey, so you want to make sure you can just decrease these or pull them off by just pulling the straps. Once this comes off, to get the air back into it, you can easily just detach the hose. Air will come back in. If that doesn't happen, you go ahead and put it on the top of the other part of the hose and just pump air back into it.